Good afternoon, everyone, and welcome to our latest webinar. And this afternoon, we're going to be talking, or we're not going to be talking, we're going to be hearing more about a COVID update, the real facts. I don't know about you, but just as you think you've got a bit of a handle on the situation and a bit of a plan, things go and change and adapt. So we have to sort of keep an eye on the facts and learn more and be adaptable. So that's why I'm really, really pleased we've got Tim and Sally with us today. I'm going to let them introduce themselves, but a little bit of housekeeping before I do. We are going to have the slides available and a recording. So if you have any technical problems or you need to leave, it will be on our website afterwards. So please feel free to sort of go back on and find it. We hope to have time for Q&A at the end of the session. Please could you use the chat box, and if you could put a Q before your chat, and then I'll have a look and see if I can find the questions and put them to Tim and Sally afterwards. So really, without any further ado, over to you, Tim and Sally. Would you like to give us your COVID update, please? Thank you.
Thank you so much indeed. Well, we've 2 seconds. Let me just get this working properly. There we go. Right, is my screen being shared?
Yes, it is.
Yeah, that's great. Sorry, my name's Tim Chester. I work with Dr. Sally Norton, and we set up a COVID testing company when we were frustrated by the limitations of the testing business at the halfway through last year. We set it up as Breathe Assured, and a little bit about our history, first of all. That before we do that, let's just go through what we're trying to cover in the next half an hour. We want to give you an update on COVID. It is a very quick moving field, COVID. It changes every day. Our understanding changes every day. We're going to talk a little bit about the COVID tests available. We're going to talk about testing for travel, what you need and when you need it. And then we're going to finish off about testing for work and in other event places. So we're a government-approved COVID testing provider. We were founded by hospital doctors ourselves. We're supported by UK wholesalers who do a lot of our logistics. And we have experimented with different types of COVID testing since the start, and we've been kind of innovative in some of the stuff we've done with online supervision and other ways of trying to mitigate the risks of COVID. We constantly adapt, and we constantly have to change everything we do. We've got full UCAS accreditation for online COVID, which is the only company actually in the world, I think we've got that. We're ISO, GDPR, HIPPA accredited, and we have full testing insurance. We started off trying to get people back into care homes, their relatives back in care homes. It was last autumn when we realised the first wave hadn't quite got rid of COVID. And people were kind of isolated from their family members in care homes. And we realised we could get tests quite cheaply. We realised through our NHS work how useful these tests were. And so we really set up to try and get some relatives back into their care homes. And soon we were testing schools, we were testing hospitality. The Olympic bobsleigh team came to us, and we tested Olympic teams. And then before we knew it, we're testing TV companies, film production companies. And then when travel kind of started again last December, the government kind of wrote to us as one of the kind of original testing companies and asked us to join their travel list, and we're on the first list of travel companies to do that. And since then, we've been involved with various companies and airlines. I'm a clinical academic working in the NHS. I'm actually an orthopaedic surgeon in my day job, but I've written a lot of national standards of care, systems of care, and I've been involved with the NICE clinical standards and quality standards committees. And I've also done a lot of device development with companies, so I know the medical device industry very well. Sally, I'll let her introduce herself.
Hi, yes, so I'm also a hospital doctor. I'm a surgeon too, and I've got a lot of background in working with corporates, actually, in working as a medical director for an insurance company and running some corporate wellness programs too. A lot of my history is around weight loss, which is quite interesting in times of COVID, when that's one of the big risk factors for getting COVID and getting serious disease. So that's been quite relevant. And like Tim, I've been involved in a lot of national and international quality standard settings. So we've spent quite a lot of time making sure that the systems that we have developed are very robust and fit in with all of the requirements and data control and research that's coming out on a daily basis, because that's how we work every day in the NHS, and we've applied that to our COVID testing company too, which is, unfortunately, it's not, you couldn't say the same for all of the companies out there, which we've found to our frustration. So we want to focus first and foremost on a high quality COVID testing service, because, you know, that's what we do. We don't want people to get sick when we go to work because we might have picked up COVID somewhere. So we test ourselves before we go into operations. We test our patients, and that's what we want to do for everybody else as well.
Thank you. So COVID update. Well, this goes out of date as soon as you said. You know, Omicron was the variant we were all waiting for. We were kind of all nervous and we all sat on our laurels thinking, you know, we've got this one cracked. And we kept on saying, unless you vaccinate the world, there's something's going to come up. We don't really know much about it. It is 38 countries from yesterday. There's no deaths reported, but you have to remember the deaths come usually after 2 or 3 weeks of COVID, and they are delayed. It spreads much easier than the Delta virus, which spread much easier than the Kent virus, which spread much easier than the Wuhan virus. And whether it's just going to be a bad cold or whether it's going to actually be lethal, we're still waiting to find out. And one of the things we do know is that vaccines and boosters are not as effective against this variant as it's shown with the Delta variant. But we are getting quite a lot of people who are triple vaccinated getting COVID. And it's causing big concern. So if you look at the UK statistics yesterday, you know, our cases, you know, reported are coming to the peak of what they were last Christmas. Hospitalizations are down, and deaths are down, which is great. But then you look at Austria and you know, the other European countries that recently locked down. This is getting out of control for their hospitals. And the reason why they locked down is their hospitals are getting full. And sometimes that's vaccination rates, sometimes that's just because it's a different environment, different healthcare services, but this is a concern for everyone. Vaccination uptake in the UK has been pretty good, but the vaccinations are not just the only answer, and you have to kind of mitigate this with regular testing and other things which Sally will mention later on. So what is a COVID test? So this is basically a graph of what you get when you get COVID. You get an exposure, which is the red dot, and then you get an increasing viral load, and up to a certain level, you're not infectious. So the first 2 or 3 days, often you're not infectious. You're probably not even ill, and you don't really notice it. And then you've got this peak viral load where it's the infectious period, and then you've got this virus still in your body, and it can be dead. It can just be very, very low numbers, but you can pick it up on different tests. Now, the different tests we use to look for current disease are basically comes into 2 bits. There's the PCR test and the rapid antigen test, or the lateral flow test. I think everyone has now done a lateral flow in the country, or what they should have done, and most people have probably done a PCR or had experience with PCR. The rapid antigen test looks for people with high viral load. They look for people who are infectious, and by picking these people out and taking them out of society, you can start trying to stop the kind of spread of a community spread of this disease. It's very, very good for doing what it's required to do, but only if you do it properly. And there's very good studies, repeated studies, showing that if you just give the population some swabs and you show them instructions and show them a video, then the sensitivity is about 50%. If they're done supervised and they have a proper sample, and you know, that means your eyes are watering, then the sensitivity goes up to 95%. So the sampling technique and the way you do them is really, really important. You don't need a lab, they are dependent on technique. PCR it's more sensitive because it picks up the whole spectrum of any virus in your body, even a dead virus. And as such, so they can be positive for 90 days after infection. So they're not very useful if you just had an infection. And we also see them positive, you know, after 9 days or so when people have got better, but they get a positive PCR, which causes them to be kind of locked down. One of the issues is that they take usually between 24 hours and 48 hours to get a result because they have to go to a lab. There are rapid areas around. Again, they do rely on your sampling technique. So if you just swab in front of your nose or you swab dog's ear, because they're all unsupervised generally, then you're not going to get a positive result. So they're as useful as well as they're performed, but they do take longer, and they measure something else. People talk about antibody tests. Now, antibody tests don't look for current disease. These look for evidence of prior disease or vaccine, and they are a kind of suggestion of immunity. There is still data coming out of this, but if you look at the graph, you can see that the antibodies produced after infection, and the IgM is one of the antibodies produced pretty quickly after infection. And then IgG is the other one, which was produced slightly slower, but is maintained for a longer period of time. These require a blood sample and usually a finger prick sample, like a diabetes check to look at. And they are useful at telling you that you've been exposed or you've had a vaccine. And there's newer types of antibodies called neutralizing antibodies, which actually indicate against a spike protein, which we're hearing about more and more. And these are the proteins which actually infiltrate the cell. And as far as we know, if you have neutralizing antibodies, you are pretty much immune to COVID. But obviously, the latest variant hasn't been tested. So let's go through some of the travel solutions, and this is a fact of life that people have to travel. Our families are split apart. Companies require multinational kind of organizations, and we have to travel a little bit to even go to work. And people are traveling, and it's about mitigating the risks and making it sensible. We know that Teams working, Zoom's working is great, but you don't get the same productivity and the same kind of design features when you meet face to face. Travel at the moment seems a really complex problem, but actually, if you rely on a company who actually does it all the time, it can be a fairly easy solution to it. Because we have experienced traveling to almost every country in the world you can do. We now know exactly what tests you need for different countries. It does change very, very frequently, and we keep up to date with that. And hopefully we can navigate the confusion for you. We're not responsible for the Saturday afternoon Boris Johnson's announcements because we get no warning of those either, but we can adapt within hours of all these arrangements, and we try and mitigate. If you have one test in one country, we can try and find you solutions for getting home and things like that. We've been travel testing since the start. We've done about 250,000 travelers already. We have to adapt to all the regulations, and actually it's interesting, we've been invited onto the British Airways, Ryanair, Jet2, and a lot of other kind of major travel companies' websites as their trusted partner, and we're one of the key partners for British Airways when they kind of do promotions and other things like that, especially with the US market. Current travel tests, and these are the latest regulations, which could change tomorrow, so please don't take these as fact. For going to most countries in Europe and going to the USA, you're going to need a rapid antigen. And in the USA, you need a supervised rapid antigen, and that's supervised from the point of sampling to the point of result. It's not a video or photo upload. They would not be acceptable. The European digital passport says you need supervised tests as well, although there are companies out there just in photo tests, which at the moment are going through, but they may not go through for much longer. Some countries you need PCRs, Middle East you still need PCRs, and some other countries you'll need PCRs as well. So you just need to know about that. PCRs are not immediate, and one of the issues with America is they changed their timing from 3 days to 1 day. So you have to have the test result within 1 day or the test within 1 day of travel, which makes a PCR completely, you can't do that. Before you travel back to the UK from anywhere in the world apart from the Channel Islands, you need a pre-departure test or pre-return test, and that's within 48 hours before you depart to the UK. That can be a PCR, again, very difficult to do within 48 hours, or a rapid antigen. And again, we do our online supervised rapid antigen tests from anywhere in the world, in their hotel rooms or sometimes in the car outside the airport to facilitate this. Once you arrive in the UK, anytime from arrival to the end of day 2, and day 0 is when you arrive, you have to perform a PCR test. Now that's changed from last week when it was a lateral flow test, a rapid antigen test. But now the PCR test is the 100%. You have to do that. Everyone has to do it, vaccinated but unvaccinated. And you can only be released from quarantine on the result of that PCR. These are all reported in real time to the government. USA have more complex tests, like if you're unvaccinated, you need a day 3 or 4 to 5 test, and other things which we can navigate if required. The tests we basically supply are the fit-to-fly, fully supervised rapid antigen tests, which you can pick up from your company if your company are getting supplies of the tests we use. We can't use NHS tests for any of these travel tests. The pre-departure tests, which obviously you need to go and take with you on your holidays or your work travel trips. And again, we can do this 7 days a week from anywhere in the world with an internet connection. And then we can do the PCR tests, which again, you have to order before you return to the UK because you need something called a unique reference number or URN to go on your passenger locator form. And we have to report that to the government on the day of your travel and have that as soon as you can, usually when you get back to the UK to release from quarantine. So you order your tests or you pick up the test from your office, depending on your situation. You basically book in and register for your test on a very secure server, which is not attached to your company. And this has been fully validated by the PHE and the UK government, GDPR compliant. You book in your nurse appointment, which is 7 days a week. It takes about 20 minutes or so. We give you half an hour appointment time, and you do your test real time in front of the nurse till the result. You get your certificate when you're online, and that certificate is valid for all the countries you travel in, and then you basically can fly. As simple as that. We started this, and when we started this, it was challenged. But actually, when you look at the test and trace testing, and you look at the other clinic testing, everyone's realized this is the way forward. You don't use PPR. You can get a much better sampling technique because you're not using masks and face masks. You're not using PPE. You're not queuing up in clinics. You're not queuing up in airports, and you're not wasting all the plastic which has been wasted at the moment. If you have a positive test, the nurse is online to explain the result to you, and you've got to remember about 1% of these tests can be either inconclusive, i.e. there could be really low level of virus, which is and it's just not sensitive enough to pick it up, or can be didn't work. About 1% of the tests won't work, and we can give you kind of options to get you back on the plane or get you back home for this. And the nurse being online is very used to kind of all these scenarios and can go through that with you. Just going back one slide, we can link our results to Verifly, which is the BA app. IATA travel pass is just coming in, and that's probably going to be the international kind of pass going through airports and things like that. But it's got QR codes. It can be linked to anywhere you want. Crucially, we have a good customer support network, 7 days a week, 24 hours a day. And we have specialist nurses and doctors response to queries. We usually respond to the queries within an hour, depending on what kind of queries they are. And we do kind of guarantee nurse appointment slots within 48 hours notice because we find regulations change regularly. People have to swap around appointments. And this is a real hassle. We try and fit people in wherever possible. Our nurses will stay late. Some of them will even do it from home at midnight if they have to get someone on a plane. We have 200 nurses who work for us full time for this. One of our great prides is our customer reviews. We've got over 4,500 customer Trustpilot reviews, and we've got over 95% 5-star reviews on that. Most of the 1 stars are related to kind of delivery of tests with Royal Mail or Hermes, or other kind of government changing regulations out of our control. But it is a good system which is well liked, and we get most of our customers are repeat customers. Day 2 tests are difficult because you need to have a URN number, and you can only get a URN number legally when you've kind of bought the test and you registered the test. So even if you have the test with you, you've taken them from the office, we do need a mechanism, and we've got those mechanisms where you have to register your test, register your travel date, your name, your passport number, and we have to report that to the Department of Health as we sell them or as we give out this URN number. And they're going to match these URN numbers with the quarantines, and people will get fined if they miss it. It's very difficult to police, but it is going to be policed. So options for Posturite customers, depending on the size of your companies and your travel requirements, and we have to respect that some companies will have small travel requirements and just need an occasional solution, and some will have much bigger travel requirements going through. And these travel restrictions are not going to go away in the near future. You see how they've just got tighter in the last week or so. We can have your own dashboard where you kind of order your tests, or you pick up your tests from the office, and then you can either use voucher codes or corporate codes if you have your test already supplied, and we can fit you in any bit of this system. And we have dedicated voucher codes on our main site if someone is not in their office or access to their office, where they can get either free tests or reduced tests for their families and things like that, depending on your corporate, the corporate nature and the agreements you have with Posturite and ourselves. And we've got a dedicated page, and this page is already out of date because we had a photo upload day 2 rapid antigen test, and this is from a week ago. But this is updated on a regular basis, and you can just go into a Posturite page where you can get the test you need, and we can go through the kind of common questions you have, because it is a very confusing field out there. Key to most companies is data and data protection. We collect all this data on a offline server. We don't keep it on any company servers. It's very secure. We're regularly reviewed by this. And if you're using a corporate code, we do ask for the employee consent to give the corporate company who supplied a test a very limited amount of data, basically your name, the test you've had, and the date you've had it, so they can kind of reconcile the test with the test. We don't give out any other data because that's not what we legally required, but we have to report the data to Public Health England on a daily basis, and that's the same with any testing you do in this country. Any test should be reported on a daily basis. And we can report, the monthly data on the number of tests and, the names of the people to the Posturite or the individual companies, depending on what your data agreements are and the data agreements with Posturite or yourselves. That's enough on travel testing. We've got questions at the end, which we're going to keep to the end. I'm going to hand over to Sally now on the workplace solutions.
Thank you very much. Well, obviously the travel testing is complicated enough. It's so complicated that it takes virtually all day, every day to keep up with the latest regulations. We have to change all our systems so many times. It's quite frustrating, but we're getting used to it now. But throughout the time when people have been travelling, we have been asked as well to do some corporate testing. Not so many people have been back in the office throughout COVID, obviously. But when they are obviously concerned about spreading COVID. So we have been involved in doing some corporate testing for the workplace too. And it's, as you might imagine, it's pretty much the same principle as for travel testing. And it's something that we do every day at work. So, it's basically just replicating what we do. Again, it's a complex problem, and we hope that we provide a simple solution, because we cover all needs now. We've had to flex with every change in regulations and the pandemic itself, so we can navigate all of that confusion, which means that not only can we provide testing for travel, but it relates very well to office working environments. If you're having work events, for example, the Christmas parties or the or team building events after all that time spent in isolation, you'll need to get your teams working together again. And then board meetings to work out where the company's going next after all of this. It's important to keep everybody safe in all of those situations. So one of the key factors we thought was going to be a problem last winter, but wasn't so much, because a lot of people were still at home. But as people are getting back into the office, people aren't so aware that there is a lot of aerosol transmission of COVID. So we know that we have to wear a mask and keep 2 meters distance because of the large droplets from coughing or speaking. But simply breathing is enough to spread these very fine droplets. So this is a person with COVID. Within 15 minutes, there's a little bit of circulating COVID around them. But if you're in a room for 60 minutes with that person, it's very likely you're going to get quite a lot of that virus in your lungs. And the higher the viral exposure, the more likely it is that you're going to get COVID as well. So that's why we have to be more concerned as we move into winter, when everyone's indoors again. It's not so much of a problem over the summer. The solution, obviously, is to try and keep some ventilation, so open the windows even when it's cold or hailing, as it has been earlier today. That helps, but there's also been a lot more emphasis on using air purifiers, filtration systems, some of which can actually kill COVID on the filter, which is good to know. So that helps. But then the other way of doing it is obviously some regular testing to try and reduce the number of people who are going to be spreading those aerosols in the office. So as Tim's already said, self-testing is not reliable, but that's what a lot of people have been relying on when they get back into the workplace. The government's obviously been providing free tests to a lot of people. But if you do them yourself, as Tim said, the accuracy can be pretty low. And if your employees are just reporting in their results, how sure are you that they're actually accurate? Unfortunately, are they really positive, or do they just want a day off work or 10 days off work? Are they really negative? Do they actually just want to get into the office because they're worried that they might not get paid properly if they don't come into work? So how much can you rely on self-reporting? And obviously you've got a duty of care to the other employees in your company, so you need to make sure it's right. The government guidelines change on a regular basis, and as I say, they're recommending just testing twice a week, which can be DIY or can be a private provider. But if you're going to use somebody externally, then businesses need to think about how they manage that safe testing setup, how they test staff appropriately and manage the data and the consent procedures, and how they report the results too. So, you know, it's not quite as easy as just buying in a box of tests and doing it yourself. So this is where hopefully we can help, because we can create a system that you can sort of bespoke it a little bit to your workplace, because you might have different numbers of staff in on different days. You might be 7 days a week. You might have night shifts, goodness knows what. So trying to have a system that's actually adaptable to your way of working is really helpful. As I said, having a high quality system is also important if you're going to protect everybody in your workforce. But in doing that, is it still cost effective? Because some of the testing solutions out there are really just quite extortionate, and it's money that none of us want to be spending, isn't it? We don't want to be paying for COVID tests. It's a situation we don't want to be in. The other thing to bear in mind is that testing causes a lot of disruption to the business. You want to minimize that. You want to make it easy for everybody, and you want to be able to adapt. I mean, this time last year, nobody, I think, had predicted that we would still be in the same situation, and who knows what it's going to be looking like at the beginning of next year. Hopefully this variant is not too serious and things are going to start dying out, but none of us know, unfortunately. So we want to try and make sure that we can create a system that's relatively future-proof. So the system that we use with our online testing is actually very, very useful for corporates. So having that supervision means that you know it's an accurate test. There's good sampling. You know what the result is. It's been verified by our nurse. And as Tim said, we can send selected data to companies to say, you know, this person's had a positive test, and no more data than that. You don't need to have a testing site at work, so you can get employees to test before they come into work rather than disrupting your office space and the day. So they're not milling around at the beginning of the working day, time when they could be actually cracking on with the job. And you're not risking spreading infection to the other people in the office while they're waiting for testing. And again, trying to save some of that PPE, because it's terrible how much, I mean, the amount of PPE that we're having to use in hospitals, and there's so much around. And then the other benefit is that we collect all the data securely, as Tim's already mentioned, and we do all the uploading of data to public health on your behalf, which makes it a lot easier, just takes that headache away. Now, it's all right doing the one-off test for travel testing here and there. It's not a huge financial burden unless you've got a family of 6 that you're taking away. But if you're testing staff on a regular basis, it can get expensive. So our system is such that we can, if you want to, do some initial online nurse supervision with your employees. And if we're confident and they're confident in technique, then we can get them to simply self-upload some videos that are then checked later on by our nurses. And if our nurses are concerned that maybe the employees aren't doing them as well as they could, we can pull them back in on their next test and get them to do it properly under supervision again. So we've worked in lots of different systems whereby we can try and maintain as high a quality as possible, but still keep the costs as low as we possibly can. And we can do random checks and quality checks for you. So, you know, the key is to try and do the very best you can in a pragmatic way, which is, you know, when you've got to spend a lot of money on something that you don't want to be spending money on, let's try and make it sensible, which is what we're trying to do. And then the corporate platform that we use means that employees can check in to perform their test, and managers can also have access to the platform at different levels. So they don't have access to all of the data, obviously, just to the data that they need, because that's very important for data privacy. But it means that managers can just check that everyone's getting their COVID test on a regular basis, or who might need a travel test and who might need an extra PCR, for example. So we've got all that availability. So we can provide a unique dashboard, customised if required. And as I said, the management system has different levels of access. It makes the whole process very simple and streamlined. Unfortunately, we have to adapt this system quite regularly as well with all the changing requirements, but it's getting to the point where we're doing it so often, it's very quick. So the platform has got the employee dashboard. So we can check ID from time to time, we can put in the quality checks, and then the managers can also see exactly what's going on. You can upload either photos or videos, or link into the nurse supervision, depending on what level of testing you need. If it's a travel test, then we do recommend the fully nurse supervised, because that will get you into virtually every country. And then obviously the security features that we've talked about, which is hugely important with all the data that's going around with COVID. So the whole system really, I think, as I've said, is fairly bespoke and adaptable. We can even pull in the antibody test to the process if required, or the flu tests. We can adjust the program to suit the needs of your company, depending on shifts and departments. And as the new regulations come in, we'll tweak everything for you, and we can upscale and downscale as required, depending on the infection rates. And we can also integrate with any occupational health or HR teams that you have who might be able to do some of the work as well. So we can link in whatever way suits. So what have we got next? So the antibodies, Tim mentioned earlier, they're actually quite useful, and I think that they're going to become more and more of a part of the regular COVID testing, because when we first had all of the COVID vaccines and people were getting COVID, we thought that actually the immunity was going to last quite a long time, to be honest. We thought, you know, maybe 1 or 2 vaccines and then you could be good for years, because it's not just the IgM and IgG, there's also a T cell immunity that is the immunity that the body uses to remember for a long time about any exposure to infection. And it means it can kick in very quickly if you're exposed again to a virus in the future. I mean, we know that you can have your mumps and mumps vaccines and you don't need to have it every 6 months, but COVID, unfortunately, doesn't seem to be going that way. So it looks like we might be having more and more vaccines. I've just had a booster in the NHS, but we know people who've had 2 vaccines and a booster and have got COVID again. So it's looking rather worrying. And it may be that actually looking at antibody status will be quite useful to know whether you're somebody who should be testing even more regularly or keeping yourself a bit more protected than somebody who's got high levels of antibodies. So we can build that into any testing regime too. And then the final thing that I want to mention, which is a little bit of a worry actually, because we're starting to see some legal challenges around this, is long COVID. I don't know how much you've heard about long COVID, but we know that there are some people who seem to be getting persisting symptoms after COVID. Some can be very severe, heart problems, mental problems that can go on for months and months. And we still don't know enough about it, unfortunately. We know that it can affect up to 20% of people after COVID to some degree. The problem that we've got is that there is no clear way of diagnosing long COVID, unfortunately. There's no test you can do for long COVID. And the symptoms of long COVID, headaches, fatigue, musculoskeletal problems, anxiety, all of these sorts of things are things that I know from my corporate work, and you guys will certainly know, are things that can put your employees off work on a fairly regular basis and leave you with quite high costs from absenteeism and presenteeism. And the fact that now it's been potentially given a label of long COVID for some people, there are going to be some definite long COVID people who we're finding more and more about. But other people will be left thinking, was this my COVID? Was it not my COVID? I'm going to call it long COVID and take some time off. It's going to be really, really difficult for HR departments to try and navigate that whole area. Obviously, long COVID is when people are off for months and months, it's going to be starting to be classed as a disability. It already is in the States to some degree. So long-term physical or mental impairment that can come and can go on for at least 12 months. That can be classed as a disability. And ACAS is already providing a lot of information for employers and employees on working with long COVID and how to adapt the workplace and to allow your staff to take time off and rest and everything. So, it is going to be a bit of a headache, I think. And I think that it is quite important to try and ensure that your company has taken appropriate steps to try and protect everyone in the workplace to a sensible, pragmatic way, to a sensible and pragmatic level, so that you're not going to be left exposed to people who are saying, look, you didn't do any testing at all, you didn't do any ventilation, the windows were closed, we were all cramped in a room, and now I've got COVID and I've got symptoms 6 months later and I can't do anything. We're starting to see a few challenges about that. So what we're trying to do is just create something that's actually sensible and that we would feel happy going into work with, because I don't want to go into work without testing myself and risk exposing my colleagues and patients. And we want everyone to sort of try and think through a sensible approach for their workplace too, so that we can all get back to work and start getting on with life, really. So, yeah, it's all about future-proofing, trying to work out some sensible solution that means that as COVID goes up and down and regulations change every 5 minutes, how can you actually get on with life and get on with work and try and reduce the disruption by just staying a step ahead? So I think that's pretty much all I wanted to say on the workplace, but I think we're happy to take questions. Was there anything else before questions? I think that's it.
I think that's it. Thank you very much, both of you. We have some interesting questions. I will start from the top, as it were. About travel, very much. A specific question about the Republic of Ireland. Do people need to test from the Republic of Ireland with the common travel?
Yes, they do. Yeah, they've introduced it. Again, I would have to look it up because it changes on a regular basis. But basically, the Republic of Ireland required tests, I think, from last week. So that, yes, you definitely need to test Republic of Ireland. But again, to be honest with you, the government website is pretty good if you want to know what to do. I mean, it's not always as updated within the hour, but certainly within 24 hours of any major change, they've updated it. And that's probably the first point of call is the government website, the travel website. They really have got their act into gear, and within 24 hours of any change, they update every single country. There's 226 countries on that. So I would use that as your first port of call, and it links to the Irish government's recommendations for travel. They will link to those.
I think the COVID restrictions are going to be very similar to doing our travel vaccinations in the past. If you're going somewhere, you'd go to your travel clinic and say, right, I'm going so and so, and they'd tell you what you need. We're going to have that sort of thing going on with COVID for some time, aren't we? I think.
Yeah.
So that's quite interesting.
Yeah.
Now, this is an interesting.
Sorry, with the Republic of Ireland, I think it's currently that you need, if you're vaccinated, you need to show an antigen test before going to the Republic, and if you're not, you need a PCR, I think. But as Tim said, it can change regularly. So.
When you get back into the UK, will be an antigen test or PCR.
Okay. There's an interesting question here. I'll read it out. In your experience, if 2 PCRs are administered to the same person at the same time by a healthcare professional and one comes back negative and the other positive, do you have any ideas what might be the explanation?
So they batch test PCRs, and it depends which company you use. So they put in 10 or 5 at a go. And if one's positive, they have to then retest all the others. Do you see what I mean?
Right.
So they batch test them, and PCRs were not as accurate as you know, they're not the gold standard, because there isn't a gold standard unless you did because they're measuring different things. It's apple and oranges versus lateral flows. And that's where around Bristol, we had all the kind of negative PCRs with positive lateral flows. No one said, you know, what's wrong? And it's one of the labs. And if you see the labs, you know, the way they worked, and I mean, they got a lot of pressure. So they went through a really difficult stage. They're not perfect. You know, they were working 24 hours a day, rapidly set up, you know, and some of the tech personnel were not trained properly. But also it's a sampling as well. And you say healthcare professional. In Test and Trace, the healthcare professionals doing the sampling were the pub workers on furlough, who had an hour instruction. And, you know, if you cut your tongue and you get acid on your tongue, it can affect the result. If you put lemon juice on the lateral flow, you can put butter on the lateral flow, it will come out as negative. It's not a control line as human kind of thing. You can cheat these things very, very easily.
Okay, brilliant. Do you know why the government has stopped providing businesses with free lateral flow tests? Any theories there, or
they paid through the roof for them. It was big industry this time last year, and they carried on paying. And I think they probably just think, you know, I mean, they're paying much more than they should do because they had to get huge contracts out from these companies. I think it's money. I think they're going to have to continue for a bit. I mean, certainly they're going to continue with care homes and NHS and schools. And they say they're going to switch them off, but you know, with the latest variant, you know, and the lateral flows are sensitive to the latest variant. We've got data on that.
Okay.
The thing is that the other thing that we should probably mention is that the government did say that they were going to stop providing free tests, but if they carry on providing free tests, we are more than happy to provide the supervision service using the government tests, because as long as they are good quality, but some of the government ones are actually not very good quality, I have to say. In fact, I think the states stopped, banned some of the ones that the UK government was using. So, but you know, any test that's supervised is better than one that's not supervised. So if the tests are there, we can use those. But the quality test, to be honest, because we know that they're reliable, the ones that we use, and we've tried various different tests over the past year, and some of them have been negative when others have been positive. If you get a positive test, it's positive, but they don't always show up as well. So we know that the tests that we use are good quality tests, and they're also recognised by America too for the travel testing, so they tick all the boxes.
We cannot use NHS tests for travel. We can make that really, really clear. So if there's workplace testing, we can use NHS tests supervised, but for travel, it's illegal, and we will be out of work and out of license if we use NHS tests for travel.
Okay. Right. It's been reported that you can fail a PCR test for up to 90 days after testing positive. Are there any alternative arrangements for travellers who have tested positive for COVID within 90 days prior to travel, but are no longer symptomatic / contagious, but still fail the fit to fly PCR test? So I suppose caught in that catch-22 type situation.
Yeah, so what you really need in that situation is to get a letter from your GP to say that you've had COVID. If you can get a letter confirming when you actually had COVID, then that is the get out clause from that point of view. I mean, ideally, if you're going to a country, that's why we believe that lateral flows are the best tests to use, because they are the tests that say whether you're infectious or not. The PCRs just confuse the situation. So if you can use a lateral flow, it's highly unlikely that that's going to stay positive at all. But failing, if you've got a country that's insisting on a PCR and you know that your PCR is still positive, then if you can get a letter from your doctor saying that you had COVID at X date, then that should do it.
I suppose, I mean, I was just listening because we were talking about doing a lateral flow test before flying and then having a PCR test to release you from quarantine. So there could be a situation that you do your lateral flow, you get into quarantine, you have a PCR, and would you have to keep doing the PCR tests until you were clear to get out of quarantine? How would that happen? How would that resolve itself?
When you're coming back, you mean?
Yeah.
Yes, again, I mean, that's slightly confusing. There isn't really a way on the NHS update form for PCR, day 2 PCRs to account for that, I don't think. But again, you would have to just have a letter from your doctor saying that you've had COVID, and therefore you're allowed out at that point. And again, that's why when they brought in the day 2 lateral flow test, we thought, well, actually, that's a really sensible solution. But they did it wrong. They said photo uploads, and we know plenty of people who are sticking a swab goodness knows where and then calling themselves Mickey Mouse and managing to get their certificate through. So
Yeah.
if they'd actually done it properly, it makes much more sense, because a negative lateral flow, fine. If you have a positive lateral flow, you then go on and get your PCR to get your genomic sequencing to see if you've brought in another variant.
Yeah.
So it's a sensible solution. But
The PCR, day 2 PCR, it makes no real sense because you don't get the result for 24 hours, 48 hours. It's not supervised at all. It costs a lot of money. It's relying on lots of different, mechanisms to work, including labs to work properly, Royal Mail to work properly, clinics to work properly. I mean, it was a Saturday announcement with no thought.
I think, I mean, it's certainly the problem with testing positive on a 2-day PCR. It would encourage people to find ways to make sure it was negative. Is my feeling on it. I think my concern if I was positive on a 2-day PCR would be quite high. And so I think we need to look at the motivations for ensuring keeping people safe are correct. So I think that's an interesting one.
And what we were finding an awful lot as well with PCRs is that people were having PCR tests and then they were just off work for goodness knows how long, because, people will say, well, we had it with people not being allowed to go into school and everything, that you've got a positive PCR, you can't come in. And you're thinking, well, I know I'm negative. It's madness.
In hospitals now, we don't use PCR, we use lateral flows.
Yeah, it's interesting, isn't it? Okay. Is there any point in an antibody test if people have had vaccinations? Would the test not pick up the vaccine and indicate antibodies are present? And then does the test results show the level of antibodies? And therefore
so I can answer that. So only about 80% of people, these vaccines work in only about 80%. Different studies, but between 80 and 90%. But the fact is, Sally was on an antibody study. We're on a vaccine study, on the original Astra study. So her antibodies fell off after 3 months. Some people never get antibodies, okay? And these are the old IgG, IgM, which looks at a slightly different profile of the capsule. The spike protein antibodies, which is the neutralizing antibodies, you do suggest immunity. If you've got antibodies to those, they do suggest immunity. Now, we would probably argue with limited data at the moment, they should be used to control the boosters rather than boosting the whole population. These vaccines are needed around the world, and we shouldn't be, if someone's got spike protein antibodies, neutralizing antibodies, we shouldn't be giving them boosters because they probably are immune, because no one's been in hospital with a spike protein antibody, as far as we know. A lot of people don't get it. 20% of people will never get antibodies, and they should probably be more aware. They should probably test more. People who don't have antibodies should test more, but we don't have that data at the moment. But for me, I test myself on neutralizing antibodies because we've got them in the house, and I'm quite happy. But when I lost them before my booster, and I did lose them, I was much more nervous.
I think that's very interesting. I mean, I certainly, I have vulnerable people that I'll be seeing, and it's part of my strategy for Christmas actually is to get antibody testing, and actually we're also doing air purification too, because as I think we said actually before the webinar, I intend to have a better Christmas than last Christmas, and I'm looking on a personal level as to how to control it. As well as on a corporate level, and I think it's quite interesting the strategies that I think we're all going to have to think very differently, I think, going forwards. So
I think we are, and I mean, it's really quite worrying, because I think we all got a little bit complacent once we'd had our our vaccines. But unfortunately, we had a colleague who died after two vaccines, double vaccinated, you know, just sort of young, clearly similar age to me, so obviously very young. But you know, when you're seeing people of the same age as you dying who are otherwise fairly fit, and they've been double vaccinated, it does make you think again. And I went straight off to get my booster because I was in the hospital, and you know, we get exposed a lot, so it isn't going away. We do need to still be careful.
Yeah, I think it is, you know, and I think, you know, knowing if, you know, how your antibodies are, I think is for me very, you know, knowledge allows you to put the right risk control measures in place, and I think that's what we need to do. Right, we don't seem to have any more questions on the chat, so that's excellent. Was there anything else that I put down here? No, I think I've exhausted mine too. So can I just say thank you very much, Sally and Tim. I did put a note that if anybody didn't want to ask a question during the recording, that they were to email us. So there might be one or two that we may come to you with later. But thank you so much, and I appreciate your time this afternoon and answering some of our questions. And I hope that's made things a little clearer for everybody. And as I said to start off with, we are going to have the recording available on our website. So if anybody did miss any of this or want to share it with their colleagues, it will be available afterwards. So thank you very much, and I hope that if they've got the rain with you now, it soon passes, and keep warm, and we'll see you very soon. So thank you very much.
Thank you.
Goodbye now.